Did you know that prostate cancer is one of the most prevalent forms of cancer that affects men all over the world for some reason? Due to the fact that it can have a significant impact on one's health, it is essential to comprehend and identify the early indications for this condition. The early detection of cancer not only improves the efficacy of treatment, but also dramatically raises the percentage of patients who survive the disease. In this video, we will explore top 10 signs of prostate cancer, which are concerns that everyone, but especially men, should be aware of. Symptoms of prostate. Number 10. Inability to urinate. Prostate cancer frequently results in urinary issues that are obvious to the patient. A weak stream of pee, trouble starting to urinate, or dribbling after they believe they have completed urinating are among the symptoms that may be experienced by men. The growing tumor can exert pressure on the urethra, which in turn restricts the flow of urine out of the bladder. This is the reason why this occurs. Number 9. Increased urination frequency. It is possible that men who have prostate cancer will experience an increased need to urinate, particularly during the dark hours of the night. These symptoms, which are collectively referred to as nocturia, manifest themselves as a result of the cancer's potential to irritate the bladder or reduce its capacity to store urine. Number 8. Pain or burning during urination. Urinating while in pain or feeling like your bladder is on fire is not only unpleasant, but it could also be a sign that someone is at risk for getting prostate cancer. This symptom may be the result of the prostate tumor inhibiting urine function or an infection that is associated with the prostate tumor. Number 7. Blood in the urine. Hematuria, often known as the appearance of blood in the urine, is a worrying sign that should not be treated lightly and should be taken seriously. It may be an indication that the prostate cancer has started to spread to the tissues that are around it or to the urinary tract. Number 6. Blood in the sperm. The presence of blood in the sperm is yet another potentially fatal indication of prostate cancer. Although it is not as prevalent as other urinary symptoms, it may be an indication that the disease is affecting the prostate or other sections of the reproductive system. Number 5. Painful ejaculation. In addition, painful ejaculation is another symptom that, despite being less frequently reported, might be an indication of prostate problems, including cancer. That sign could be caused by two things: the pressure of a tumor or swelling in the area around the tumor. Number 4. Persistent pain in lower back, hips, or pelvis. Prolonged discomfort in the lower back, hips, or pelvis is the 7th symptom. If you experience discomfort that is severe and chronic in the lower back, hips, or pelvic region, it may be an indication that the prostate cancer has migrated to the bones. The pain that is associated with cancer can be subtle or intense, and it can present itself either continuously or intermittently. Number 3. Erectile dysfunction. There is a possible connection between erectile dysfunction, ED, and prostate cancer. The condition can cause nerves and blood vessels that are necessary for an erection to get damaged, which can result in a disruption of erectile function. Sexual dysfunction in men who have prostate cancer may also be the result of psychological stress brought on by the disease. Number 2. Loss of bladder control. Urinary incontinence is a potential complication of prostate cancer. There are a few ways in which this might express itself, including having trouble controlling the beginning of urination, having problems completely emptying the bladder, or suffering involuntary leakage of pee. Number 1. Unexplained weight loss and fatigue. There are a number of symptoms that may suggest advanced prostate cancer, including chronic fatigue and significant weight loss that cannot be explained. These symptoms manifest themselves when the body's resources are increasingly redirected toward the battle against cancer, and as the cancer consumes a greater proportion of the body's energy. Let us talk about the kinds of people who are most likely to get prostate cancer. In order to initiate successful prevention and early identification of prostate cancer, it is essential to have a solid understanding of the risk factors that are connected with the disease. In this article, we will investigate the significant elements that have a role in the development of this prevalent and potentially life-altering condition. Number 8. Age. One of the most important risk factors for prostate cancer is getting older. There is a significant increase in the likelihood of developing prostate cancer as one gets older, particularly after the age of 50. Despite the fact that HPV can afflict younger men, the majority of cases are detected in people who are older. This highlights the need for regular checks as one gets older. Number 7. Family history. An individual's risk of developing prostate cancer is increased when there is a history of the disease in their family. A person's likelihood of developing prostate cancer is increased if a close family member, such as a father or brother, has already been diagnosed with the disease. In order to gain valuable insights into probable inherited predispositions, it is essential to have a thorough understanding of each individual's family medical history. Number 6. The influence of genetic factors. Some genes may make you more likely to get prostate cancer, along with a family history of the disease. There is a possibility that certain gene abnormalities, such as BRCA1 and BRCA2, which are currently associated with breast and ovarian cancer, may also have a role in the progression of prostate cancer. People can have a better understanding of their hereditary risks through the use of genetic counseling. Number 5. Excessive weight. In terms of the health of the prostate, obesity is a significant risk factor. There is a correlation between being overweight or obese and an increased chance of developing prostate-related disorders, including prostate cancer. Research has shown that those who are obese have a higher risk of developing aggressive prostate cancer and also have a higher probability of the cancer return after treatment has been completed. The precise mechanisms that link obesity and prostate health are unknown. Nonetheless, it is believed that excess body fat contributes to hormonal changes and inflammation, hence producing an environment that is conducive to the development and progression of prostate disorders. For the sake of overall health, including the health of the prostate, it is essential to keep a healthy weight by eating well and engaging in regular physical activity. By addressing lifestyle factors like obesity, individuals might reduce the likelihood that they will develop potential health problems related to their prostate. Number 4. The concepts of race and ethnicity. The chance of developing prostate cancer is heavily influenced by factors such as race and ethnicity. For instance, African American men have a higher risk of developing prostate cancer and are more likely to experience aggressive forms of the disease within their bodies. When it comes to targeted tests and therapies, having an awareness of the distinctions between races is absolutely necessary. Number 3. Options for a lifestyle. One's way of life can have an impact on the likelihood of developing prostate cancer. It's possible that diets that are high in saturated fats but low in fruits and vegetables could make the risk higher. There is also a correlation between sedentary behaviors and obesity, which has been linked to an increased risk of developing prostate cancer. You may help lower these risk factors by adopting a healthy lifestyle, which includes engaging in regular physical activity and eating a diet that is well balanced. Number 2. Workplace hazards and exposures. There has been a correlation established between occupational exposure to chemicals such as cadmium or orange agents and an increased chance of developing prostate cancer. Individuals who have had certain employment histories may benefit from having conversations with healthcare practitioners about the potential hazards they face, as this will allow for a more accurate assessment of their risk. Number 1. Inflammation and the welfare of the prostate. It is possible that the chance of developing prostate cancer is increased by persistent inflammation of the prostate, such as prostatitis. In order to maintain general health and reduce risk, it is essential to monitor and manage prostate health issues, including inflammation. It is possible for individuals to make more informed decisions regarding their health if they are aware of the interconnected chain of risk factors for prostate cancer. Regular screenings and making modifications to one's lifestyle that are reasonable can be of assistance in early intervention and lead to a life that is healthier and more watchful. Because prostate cancer has such a severe influence on health, early symptom diagnosis is absolutely necessary for making therapy more successful and increasing the likelihood of survival. The top 10 symptoms of prostate cancer will be discussed in this video. Some of the key signs that will be highlighted include difficulty urinating, increased urination frequency, pain during urination, blood in urine or semen, painful ejaculation, persistent pain in the lower back, hips, or pelvis, erectile dysfunction, loss of bladder control, along with unexplained weight loss and fatigue. It is possible for individuals to gain the ability to seek prompt medical counsel if they are aware of these signs, which could allow them to potentially catch the disease in its early stages when it is most treatable. Remember to subscribe, share, and leave a comment in order to help in the dissemination of this important information.